Alright, hello everyone. My name is Emily, and I'm doing case study number 7 on Tay Sachs disease. Alright, let's get started. So Rick and Samantha, an Ashkenazi Jewish couple, were referred to the genetics clinic for evaluation of their risk of their child having Tay Sachs disease. Samantha had an older sister who died of Tay Sachs disease as a child. Her sister never learned to walk, went blind, and had severe seizures before she died at the age of 3. Before I continue, I'm going to point out some big key points that I'll go over just by some of the information provided to us in the case study. So we get some historical information about where in the world the parents came from and from what culture they came from. Second, they're already being referred to the genetics clinic because Samantha's sister died from Tay Sachs as a child. So Samantha has a 50% chance of being a carrier of the fatal disease. Her sister seemed to have died fairly early, given that she was only 3, still went through most of the symptoms. As we look closer into the Tay Sachs disorder, we find that it is an autosomal recessive disorder that occurs in chromosome 15. Missense mutations along with insertions cause enzymes hexosaminidase A to not work properly. Hexosaminidase A is a vital hydrolytic enzyme found in lysosomes that break down lysolipids. When hexosaminidase A is no longer functioning properly, the lipids accumulate in the brain and interfere with normal biological processes. Hexosaminidase A specifically breaks down fatty acids called nucleosides. These are made and biodegraded rapidly in early life as the brain develops. Hexosaminidase A deficiency, or Tay Sachs disorder, is commonly found in Ashkenazi Jews. I don't know if Adam Sandler is a carrier, but just something funny to think about. Tay Sachs carriers are found most frequently among families of Eastern European Jewish descent. In the United States today, approximately 1 in every 27 Jews is a Tay Sachs carrier. Among the Jews of Sephardic origin and in general, non-Jewish population, the carrier rate is about 1 in 250. Also, French Canadian and the Cajun community of Louisiana have the same carrier rate as Ashkenazi Jews, 1 in 27. And also, individuals with ancestry from Ireland are at increased risk for Tay Sachs gene. But unfortunately, this disorder affects mostly infants. A baby with Tay Sachs disease appears healthy at birth and seems to be developing normally for a few months. Symptoms generally appear by 6 months of age. While symptoms vary from one child to the next, there is always slowing down of development. Gradually, Tay Sachs children lose motor skills and mental functions. Over time, the child becomes blind, deaf, mentally retarded, paralyzed, and non-responsive to the environment. Tay Sachs children usually die by the age of 5. A simple way to determine if someone is a carrier of Tay Sachs is by taking a Tay Sachs blood test, referred to as carrier screening. This identifies Tay Sachs carriers and non-carriers. It is urgent to understand that the Tay Sachs gene gets passed from one generation to the next. Without carrier screening, it can remain hidden in a family for decades, surfacing unexpectedly and tragically with the birth of an infected child. Also, there can be cherry red spots in the back of the eyes of the child, yet another sign. Unfortunately, there is no treatment or cure for Tay Sachs disease as of now. There are only medications that are given to control some of the symptoms, like seizures. Feeding tubes are given because the child may develop respiratory problems from inhaling food and liquids into their lungs while eating. Physical therapy may help keep joints flexible and maintain as much ability to move as possible. And of course, family support to help the family cope with their child's special needs. As we come to an end, when a family is worried about the children getting Tay Sachs, a simple blood test can be determined if someone is a carrier of Tay Sachs and provide further answers to whether their child will get Tay Sachs. During the 12th and 10th week of pregnancy, an expectant mother can get a chorionic villus sampling, or CVS, in which a small sample of placenta is drawn into a needle or a small tube for analysis to see if the child will have it. If the test comes back and the child does have Tay Sachs, then the mother has an option to abort it, but that can be another issue for some people. Should they get tested to see what to do with the child, or should they just see what happens after the baby is born? If it does have Tay Sachs, the child will probably live to see till the age of 5. However, they will acquire symptoms like blindness, deafness, and loss of motor skills. Since there isn't treatment for or a cure for Tay Sachs, it's an important decision that shouldn't be taken lightly. But if it wasn't for important decisions in our lives, where would we be now? Thank you.